if there is someone at home that's family members are worried maybe their loved one has fallen and is not reporting it, excuse me, or they think they might be at risk, what tips could you give them? What should they do?
You know, the fall risk initiative to test and obviously prevent falls is something that has taken a high priority from both CMS and the CDC. We've heard about the STEADY algorithm, which the STEADY algorithm is a fancy chart that medical providers are, asked to follow in regard to what's the best way to obviously, mitigate a fall risk or anything like that. Has the person fallen before? Check, go here, or not, go here. And so there's different things that we can do, in that regard. But if we're at home, and I had a concern again, the best way again is to obviously contact a physician, or feel free to go to our website, www.safe-balance.com. We can partner you with one of our Safe Balance licensees in the area, who can then obviously provide you with this comprehensive assessment as part of their protocol, and go from there, provide this information to your physician, and most importantly, if we find something that you're aware of or maybe not necessarily aware of, we can obviously address it preemptively rather than reactively.